Breast cancer rehabilitation. This week I'll be talking about shoulder movement and shoulder function. And what happens is that this can be interrupted with the surgery, radiotherapy, and even chemo, I think, has a role to play in how your shoulder is moving and how strong it is. The reason why the shoulder goes a little astray is because of the tightness within the chest from the scar or from the muscles can interrupt movement between the shoulder blade and the arm bone. And in fact, there's research now that shows that there is this movement discrepancy. Now, we might not feel that on a day-to-day basis, but what you may feel is that there is a weakness for tasks that require the arm to be up a little higher. From research in Australia, from Sandy Hayes and her group, where they've followed women 6 years after their surgery, they've found that at least 50% of women have a shoulder problem in their normal day. And so that's 50% of women 6 years down the track. And in fact, it's not just a shoulder problem, but the women have rated it as an adverse problem, so an adverse effect. So that's a rating where they've said, well, this really is impacting on my day. So what do we need to do as women after breast cancer surgery and the breast cancer treatments? What can we do to check how our shoulder is going and then also be able to treat it? What I would like to do is show you some ways of testing your shoulder and also then how to treat it. This is a very simple test that I use, and it's one that shows how we can be so easily misled or we can misread our body, and this shoulder condition continues to worsen or make a difference to our day. So the stretch is be up nice and straight, and what we're doing is just bringing the arm across the body. And so what we're doing is testing the flexibility of the muscles on the back of the shoulder blade. Now, when you do it, just double check that you're not doing this, so you're not rotating your body. Because if I rotate my body, it looks like I'm fantastic. In fact, this is my better arm. I'm going to do my other arm. So if I rotate my body, it doesn't look like I've got a problem. But if I stay still, keep my shoulder back against with the shoulder blade against the ribs, and then draw it across, that's where you can assess how those muscles at the back of the shoulder blade are. Now, I would say, well, compared to the other side, this is my stiff side. So for the treatment, so we've got the shoulder back, we're just drawing it across to that first point where you can feel that's a little bit stiff. From here, we very gently push the elbow back into the hand. So push the elbow back into the hand for 10 seconds. Now, if I had to guess, I would just say something like 1% power. So gently for 10 seconds, press in the elbow into the hand. At the end of 10 seconds, then relax. The muscle releases. And then you say, well, how much release did I get? And then draw it across. Well, I would say that was a pretty good result. So I'll do it again. So tension the elbow into the hand, 6, 7, 8, 9, 10. Then I say to myself, relax. So let the muscle release. And then after you feel it relax, then you draw it back a little bit further. So this is a good treatment for the shoulder muscles. So I'm just letting you know that I'm down at Port Stephens, and I'm going to flash you a look out there because it is beautiful and very inspiring. So that's why I'm down here talking to you this morning. And so this is Port Stephens, just a little bit north of Newcastle, and look at the day. But we can still take time to stretch. So we've run through 2 stretches, stretch of the back of the shoulder blade muscles and stretch of the neck muscles in a yes nod. So you can do these wherever you may be. If you are interested in ways of being able to make a difference to your shoulder and a difference to your neck after breast cancer surgery and the follow-up treatments, then subscribe, because I'll be producing new videos about topics that really affect women after breast cancer. Press the subscribe button, and that means that you get access to my new videos without the effort of going looking.